Okay, so today we will be starting an IV on our patient. A few things we want to consider before going in is the patient's hydration status. We want to make sure we are checking the patient's weight, skin turgor, edema, blood pressure, urine output, and just overall lab values that would indicate that this patient might be dehydrated. Dehydration can sometimes make these veins thin and delicate, and which makes it harder to start an IV, so that's an important thing to consider. Another thing would be allergies. Or allergies either to the adhesive, latex, or iodine. Our kit has chlorhexidine and our patient isn't allergic to that, and it is also latex free, so again, we don't have to worry about that. Another thing we want to consider is the bleeding tendencies of the patient. So are these patients on blood thinners? If they are on blood thinners, we want to make sure we are applying pressure for a longer period of time. Lastly, we want to look at the physician's order, which will tell us the type of fluid, the rate and volume, and just the duration of the IV that we will be using. And then we also want to look at the status of the vein. So physician's order and the status of the vein will help us determine the size of our needle. Oh, before I forget, I should also mention that we want to look at the patient's history for any surgeries, such as lymph nodes removal or a mastectomy, because we wouldn't want to do our IV there. So I think that covers everything we want to look for. I think we're ready to go into our patient's room. So let's go. Okay.
Hello.
Hello, I'm Yasmin. I'll be your student nurse today. Can I have your name and date of birth?
Ka Zhang, 524, blah, blah, blah.
Perfect. I'm here to start an IV because your doctor has prescribed IV antibiotics and to prevent any infection. So I will start off by cleaning off my table and setting my supplies. Okay, Ka?
Mm-hmm.
So again, we've checked expiration dates and allergies, so we are good. Tourniquet, our prep, our gauze just in case, our tape. I've cut my tape down here. Our pre-filled syringe that is primed and ready to go, our PosiFlow, our J-loop, and the needle that we will be using today. Okay, I'm going to prime my tubing, and we're going to keep this in the package. Okay. Okay. And this thing. Oh my goodness, it's like so tight in there. Okay, we got it. Okay, we're going to prime it and leave it in the package. In the packaging. Okay. All right, Ka, have you had an IV started on you before?
Yes.
Oh, awesome. Is there an arm that you prefer that I use?
The left arm.
Oh, okay. So I'm gonna go ahead and put my chucks underneath the patient or the towel, whatever we are using, and apply our tourniquet. Okay. And I can fit a finger in here, so we are good, nice and tight. And now I'm going to select my site. So I'm looking for a vein that is resilient, soft, and bounces back. If we couldn't find a vein, we would have our patient put their arm in a dependent position, make a fist and pump their fist. This can bring blood flow to the veins better. Or we could also put warm washcloths on this patient's arm while we set our supplies. Other things that we want to look for when we're starting an IV is avoiding any bony prominences, areas of flexion. The area right here is kind of delicate. The veins are delicate in this area, so we want to try to avoid these, and as well as the ones underneath here. We want to try to use the arms distal to the veins distal to the arm first, and we want to make sure that the vein we are selecting isn't near any scars or anything like that. So that looks good. I think I'm gonna do this one right here. Okay, so now that we've selected our site, we can remove the tourniquet. Perform hand hygiene. Okay, Ka, this is gonna hurt a little bit. It's gonna be a little poke, okay?
Okay.
I'm gonna put on my gloves. Hold on. I'm gonna, let's pretend I did. Before I put on my gloves, let me just get the needle. I wash my hands, and I'm going to open my needle here. Okay, now washing my hands again, just to be safe here. Put on my gloves. Okay, and apply our tourniquet back on. These gloves are a little bit big. Okay, so now we're going to clean the area that we're going to use for 30 seconds. In circular motions, up and down. Doesn't matter as long as we're using friction. You can just hear the friction there. Okay. So while we allow that to dry, I want to tell you guys that we shouldn't touch the area after cleaning it. We shouldn't blow on it or fan it out, because that would defeat the purpose of the chlorhexidine. Okay, so a couple more seconds for that to dry. We're gonna take our needle, making sure that the bevel is pointing up. Okay, we're going to anchor our vein. Select the vein, watch for any blood return. Okay, I see blood return, so we're going to advance and push forward. Okay, release the tourniquet. Apply some pressure. Get our J-loop ready. And we're gonna do this quick. Take the needle out, apply J-loop, good. Okay, we're going to aspirate for blood return. Okay, I am getting blood return. It's kind of light to see here, but there is. So I'm just going to flush. Flush with the whole thing. Since. How are you feeling, Ka? I'm making sure it's not going into the subcutaneous tissue or anything. Do you feel okay?
Good. Yep.
Okay, well, it looks good. Now I'm going to clamp this just like this. Remove my syringe. Okay, we're gonna apply some tape. Okay. We would clean the area if there was some blood there. Now we're ready for dressing here. My gloves are sticky. Perfect. So now we will dispose of our supplies according to policy, perform hand hygiene, and document our findings. So in this case, we would document the site, the date and time, the blood return, type of dressing we used, the patient's response, and let's see. I think that covers everything. The
And the gauge of the
stabilization
needle.
device that we use.
So now we can dispose of our supplies that are drippable, pourable, squeezable into the red bag and our sharps into the sharps container.